Good evening. I'm your host, Arlana Shikongo, and welcome to another episode of Heartbeat. For the past year and a half, we've been living in the grips of the COVID-19 pandemic. The effects of COVID-19 has been felt in most homes. Survivors are faced with the trauma of having had the virus, while some families reel after the loss of loved ones who battled to survive. Tonight, we're joined by mental health specialists to address the mental health impacts of living through a pandemic. Joining us via Zoom, we have Dr. Hileni Ndjaba, who is a registered psychiatrist and the head of the Mental Health Care Center at Windhoek Central Hospital. In studio with us, we have Esther Awuke, a clinical psychologist working with the Ministry of Health and Social Services, who has also at the mental health unit, who has been working in the field of psychology for the past 13 years. Dr. Esther, thank you both so much for joining us this evening. And I really look forward to having a much needed discussion on the impacts of the COVID-19 pandemic on mental health. But before we get started on that, I'm just going to share some details of a story that the Namibian published about a week ago about some people who have experienced the loss of multiple family members due to COVID-19. Two former football players, Mr. Marlin Garidemo and Mr. Stephen Mbaisa, both had to bury multiple family members on one day. Both of them, Mr. Ngaridemo had lost, I think, about 15 family members had succumbed to the virus, while for Mr. Mbaisa, about 6 family members had succumbed to the virus. And just looking at those figures, losing a loved one is a very traumatic experience on its own. Losing multiple loved ones all at once caused by a virus can be even more traumatic than I think anybody can imagine. So tonight, I think right off the bat, I'll start with this question for Dr. Ndjaba. If you can just talk us through what some of the psychological implications might be that come with the effects of living in, this perpetual state of fear or worry, and what it can do to somebody's mental health. Dr. Ndjaba?
Good evening, and I would like to apologize that you will not be able to see my face. It's not a making, it is the technology.
Technical difficulties.
Thank you for the very important topic in the happening of our country currently. It is true we are having a pandemic of COVID in the country, and the psychosocial effect that it has, it's very, very tremendous. That first of all, we start with fear, then fear, we go to anxiety, then depression. And mostly is the fear of unknown and the fear of things that we know, but also denial and acceptance. And people are really suffering, especially when you just made a statement to say some family members have even lost 3 people at a go at the same time. One may understand that because it is a communicable disease, which means that if we are sharing a setup, being in the same household, it is possible that if one gets the COVID, the possibility to spread it to another person is very, very high. In fact, even the older people in the villages where they think they are being isolated, they are even questioning to how they contracted COVID. So now it's not a research, but people are saying these old people are not staying in isolation. They are staying with their family members, especially the young ones that goes out to cooker shops and outside. And when they contracted it, they will bring it home to even those who are even bedridden. One may even ask to say, if the person is a bedridden at home, how did this person then contracted COVID? And the most that is coming out is the burial. People are now traumatized just by means of looking at those people who are funeral undertakers wearing the PPE, personal protective equipment. That is now that we are getting from the community, that they are very traumatized, and this, they feel that it will go on with them for the rest of their life to see how their loved one were buried. And in fact, they are even making it to say, okay, we want to accept that at least people are wearing PPE, and a few of our family members are allowed at least to attend the burial, unlike what happened in the past when COVID came. Yeah. I was even with the family when I was called to say I need to speak about the psychosocial impact that COVID had. And I visited a family of almost many of the parents and the children. They also suffer from COVID, but luckily enough, they did not die. And I just wanted to have their feel so that when I come here, I don't speak my own thing as a psychiatrist, but from the host's mouth. How do they feel about it? They say they were afraid, they become anxious, and they also went into depression. And also, they felt that some of the family members, they felt rejected. They also felt that people were looking forward to say, perhaps they will not make it, because apparently some people have already made arrangement to say, please clean up, because people in Windhoek are suffering from COVID, which you can conclude they are likely to die, and there will be a funeral arrangement. So if one has to go through that, it is very painful. And some people also look at COVID as if it's a stigma or a shameful disease. So with all those, you can now see the impact that the community it is going through. And again, when it comes out for the elders, as I'm saying, now when you hear an elders has passed on, you hear people are making comments. So, auntie so, granny so, grandpapa so died. But of course, nothing else. You hear that the person died of COVID. So it is like people are even expressing their emotion. They are so angry with the disease. They have so many questions. Where does this disease come from? When are we going to have the treatment? But again, at the same time, as you see, these people are angry about it. But their protocol, their procedure that we should follow to prevent the further spread of the COVID-19. But there are also many information that is circulating in the media, which of more, when you see the truth information is not what is coming out. And when I ask, then they say, you health workers, I think you fail us from the beginning to give us the right information so that people can make the decision, which of course is not true. On the other hand, if you look at it, all the right information were given from the beginning, all the information were shared, even where to go when you find yourself having a problem, but people were not making use of it. They rather than take what the media is saying. For instance, I was just reading this week, somebody saying, why is it that COVID is only killing prominent people, professional people? And the person further went on to say, but we have not heard somebody who is mentally ill died of COVID, because you expect to say these are people who perhaps will not wear masks, these are people who perhaps will not sanitize, these are people who perhaps will not keep the distance, and these are people who are not isolating themselves. So to respond on that, and I also just make to say, okay, God will not give everything to somebody. This is somebody who already have a mental illness. Why then should this person, the same person that also suffer from mental illness? I know it is not to say they do not suffer from a mental illness point of view, but I mean to COVID. But when you compare and what the society was expecting, because this person is already having a mental illness, we were also anticipating, because us as mental health professionals, to say what will happen now to our people who perhaps they will not be able to follow the procedures and protocol as to how to prevent themselves and to protect others not to get COVID. But luckily enough, we do not have a big number of people who suffer from mental illness that have also suffered from COVID. The figure is there, but I do not have exactly what the number of people who have suffered, but it's not as much as compared to the general population.
Yeah. And doctor, you actually raised really good points that I think a lot of people don't even think about in terms of the feeling of anger towards the virus and how it's ravaging our communities. Esther, I also want to get from you perhaps just your experience of patients coming in seeking psychological treatment as a result of, the state of living in a pandemic.
Okay. As doctors alluded to, there's a lot of anxiety that comes with dealing with a pandemic, especially COVID, where it's a new illness. There's not a lot of answers out there, more questions than answers. People are insecure about the vaccine. They're not sure if it's safe. There are those, and treatment, sometimes there's a lack of adequate treatment. If you look around the world, even in Namibia, we've had shortages of oxygen and ventilators and so on, and shortages of beds. So people feel scared that if they do get seriously sick, they might not get the best treatment. So like I said, the majority of the feelings that people go through is anxiety. Depression is also an issue, because anxiety and depression are sister should I say, illnesses. Anxiety can lead to depression or some depressive symptoms, feelings of hopelessness, feelings of worthlessness. COVID has led to job losses as well and financial insecurities. So people feel that they can't control what's happening around them, what's happening in their lives, what's happening to them physically as well. Even survivors of COVID, some still have residual symptoms and they still feel like maybe they might still die. So there is that fear of death and fear of dying. For those that have lost loved ones, there's that sense of shock and denial. Did this really happen? Is my loved one really gone? Anger towards themselves, towards God. They go through a lot of emotions. Depression is one of them. And it's very hard. I mean, if you lose one loved one, it takes a while for you to get over it. If you lose multiple, you can imagine the psychological impact that has on someone. It's going to, we don't even know yet, because this is unprecedented in history, where we're having something that's killing people so fast, especially with the recent wave, the Delta wave. It's actually shocked quite a lot of us. Even as healthcare workers, we don't really know how to contain and hold these people. But we have to do what we need to. And like I said, research is still occurring, and we just need to move with what's happening currently.
And definitely with that uncertainty, I can understand and see why that would further fuel anger, frustration. It would be anxiety inducing. And I can imagine, a lot of people are almost living in a state of panic because they're so fearful of not knowing what's going to happen, how long we're going to be living in this state of affairs. One thing that I have observed from people in general is describing this experience as traumatic. And maybe, Esther, if you can just give us a little bit of an understanding of what trauma is and how trauma is induced.
Okay. Someone experiences trauma when they go through an experience that they feel is life-threatening towards them. For example, a life-threatening event can be an accident. It can be a natural disaster, pandemic like this, where you fear that you could die or your loved one could die. And sometimes it's also through hearing when you keep hearing stories of other people dying. So you can get traumatized by that. So it creates a feeling of unsettledness, of trauma, of anxiety inside you, because you don't know what's going to happen. You feel like you might not live. So the body reacts to that physiologically. So you start having, some people have heart palpitations, some people can't sleep. There's a lot of restlessness. Some people might re-experience the trauma even after the event has already happened. In the case of COVID, you might if you are severely sick and you were in the hospital, you might keep picturing yourself in the ventilator or seeing other people die. I have heard stories of people that have been in COVID units that have just been seeing people dying around them. So all of that is quite traumatic because, like I said, it's an experience where you feel like you could die, or people around you are dying, or people close to you could die, and you have absolutely no control over that circumstance.
Yeah. And naturally, it's almost like the uncertainty and just that perpetual state of being in fear and worrying, feeling like you're in a situation that's life-threatening, continuously life-threatening, would 100% induce some sort of trauma response.
Yes.
But I just kind of want to go back to what Dr. Ndjaba mentioned about some of the messaging that people are coming across in the media. Now, with people living in this perpetual state of fear, worry, anxiety, is it maybe a little bit of a problem that the messaging that's going out has been this image of terror? You know, COVID has been depicted in all capacities as something, you know, to constantly be scared of. You don't know where it's lurking. You don't know who has it. And if that is the case, that this, you know, the sense of terror is being too focused on, what can be done better, or what can people do to alleviate that fear, to alleviate that worry, Dr. Ndjaba?
Okay, it's just because the time is running fast. And I think what we really need to do was to do some research, especially if the research can be done to say, like one of the questions that came from the family I visited, and this is not the first time I'm hearing this question, it is they wanted to know how if infectious is the dead body. How is it that somebody who have died of COVID and before the body buried, how is it that can transmit the COVID to other people? Then I ask, why do you want to know about that? They want to know because they want to see that perhaps there should be a way of handling the remains of somebody who died of COVID in a way that it does not create that fear, trauma, which of course, when you look at the younger ones and even the adults likewise, we are anticipating that the sentiments, their expression they are giving, we might then end up having PTSD, post-traumatic stress disorder. And we wouldn't want to handle that if there is a possibility that perhaps research can be done and to see to it that how infectious is the body. We know, of course, I'm aware that a person who contracted the virus can transmit it to another person. But then another suggestion from the community is that what if then, for instance, whoever is attending, that they close up all the openings. Say, for instance, somebody has died and at least the person is cleaned, then the nose is tucked, the mouth is tucked, and wherever possible that can bring about the fluid that might contain the virus. Then from there, then this person can then be given a barrier where no one is afraid or no one is being given information to say if then you attend to this person who died, you are likely to contract COVID. And also the question that the community is want an answer to it is to say, after then the barriers have done, the soil has been put on somebody who's 6 feet below. How is it that the COVID virus is still effective? Because people are told, not even some of them, the information is coming. They should not even put flowers on the grave. They should have to wait for some times before they come and visit the grave. All those create fear. And maybe if research could have been done so that we know that at least this coffin was just brought in, was lowered down, and nothing of contamination of the soil, then perhaps then people can have some clear information, because now people are living with this fear and with too many of information which we do not, the community does not know exactly how credible this information. And that's why now you see people are spreading their own information, and the community is quicker to absorb the information that is being spread from other people with no knowledge at all. I remember even when it comes to treatment and even it comes to advice, so many people have been giving advice, maybe how to protect yourself, what to use, and the people have gone to use even the elephant dung and all those kind of information. And when you look at of the elephant dung being burned, and there is that smoke which is coming out, and the COVID virus affects the lungs, and now you are poisoning the lungs. So the likelihood for you to develop a complication is high. So maybe now it's very difficult, because as information is being pouring, then the community is now confused. They don't know which one is the right information and which one is the wrong information. But the people are really need that information to come the right one. But it is going to be very, very difficult, because there's no way you can stop other information, people not to receive it, and you give them information which you think these are the correct information. Even with the correct information, where we are saying people should go for vaccine. Because now the question is, when they see that the announcement of people who died due to COVID, among those who died, how many have received vaccine? Then they will say, you see, I told you. Then if the person was vaccinated, why then the patient should die? But then they do not understand that this vaccine is not a cure for COVID. It is also not a preventive for COVID. A person can still acquire the virus, but then the person may not suffer. The symptom may not be seriously leading into complication, including death. But at least the person may acquire the virus, but the person may not even show the symptom, can be tested and may test positive, but not having serious symptoms of the COVID.
I think that understanding is slowly starting to seep, into the understanding of the general community, because there is now a lot more messaging, especially around the vaccine drive, to encourage that and share the right information. I think there's been a very big push to get that done and to get that understanding into the communities. But regarding the burials, Doctor, you mentioned something that I think we should address from the psychological perspective. Esther, I'm going to pose this question to you, and it has to do with grief. There are the various stages of grief that people have to go through, and with the general or the usual form of burial, one of the methods in which someone can get closure is to see the body for the last time, say their goodbyes, and then move on, through the stages of grief. But now that there isn't that opportunity to say the final goodbye, how is grief now going to look when people are not able to get that closure?
Yeah, no, it's quite difficult because, like you said, the COVID protocols do not allow people to go through their cultural, traditional practices of, should I say, grieving. Okay, we can't gather together anymore. You can't view the body. You can't comfort each other. You don't have the wakes. No memorial services. Funeral services are few. Only a few people are allowed there. Yeah. And usually, especially as Africans, we thrive on that community.
Yes.
Being able to be there for each other, being able to talk about what's happening, cry on someone's shoulder over this loss. But now that is missing. And this is what's causing a lot of psychopathology, a lot of illnesses, like depression, for example, where you have to now contain these feelings and you don't know what to do with them. Previously you would be able to have someone there and you could talk and cry with them, but now they're not there anymore. So, like I said, we don't really know what impact this might have years to come or months to come because it's relatively new. We foresee a lot of, like I said, quite severe psychopathology in relation to this type of grief. Like I said, I've seen individuals that have had multiple losses in one family, and they just feel hopeless. They don't even know how to respond anymore. Some tell me they don't even want to pick up the phone, or because every time they see the phone ringing, a family member calling, they suspect that it's news of someone who's passed away. And they just feel so overwhelmed with the news, they don't know how to cope with that. So it's literally one situation, one death after the other, one loss after another. And a lot of people are still in the first phase of grieving, which is shock and denial. Is this really true? Or it's not happening, So some people would just pretend that this is not happening. Those people have traveled and they're going to come back. And it's their own way, I suppose, of trying to cope with what's happening. We don't know how this is going to impact their psychological health in the future. Obviously, there are serious ramifications to not dealing with your emotions. But sometimes our body wants to protect us from traumatic news and so on. But grief is definitely important, and it's important that people go through the grieving process in order to get that closure. We have to find new ways of trying to grieve. The old traditional ways are not going to work anymore, so we need to find ways on how to cope with this new normal for us.
Yeah. And thinking about coping mechanisms, people who are battling COVID, be that at home or in the hospital even, I'm sure that there's a lot of psychological workings going on in their mind. As you mentioned earlier, there's that constant fear that they could potentially die while they're, trying to battle the virus. So when we're thinking about coping, for people that are in a hospital, in the situation where they are sitting with COVID, they're waiting for the days to pass for their doctor to say, you're in the clear, you can go home. How can people, or what should people do in a situation like that to allow themselves to cope through that experience?
Yeah, it's difficult, especially when you're isolated or when you're in an isolation facility, to not look at your reality. Your reality looks grim. Sometimes outcomes are not very positive, but it's important to try and change the focus of your thinking from the negative to something more positive. For those that are religious or spiritual, they can pray, read the Bible, meditate, maybe focus on inspirational books and journals just to uplift the spirit. You can hum or sing something that's going to encourage you to feel more positive. But the important thing is not to focus on the negative, because that's something that's completely outside your control. The illness is there and it's happening. there's nothing really that you can do. You must just basically pray and hope that any treatment that you're being administered would actually work for you.
Absolutely.
Yes. So, but it's important to just have that positive mindset.
Yeah.
Yeah, it goes a long way to recovery.
Absolutely. And of course, the mind is such a powerful tool, you know, and I've always wondered, how much does the mental aspect of battling a virus, any virus really, how much does the mental aspect of it affect what happens physiologically? Dr. Ndjaba, if you can maybe speak to us about that, just specifically how the mental aspect plays into the physiological reality of somebody that's battling a virus.
Okay, thank you for that concern. What happened is that there is a process that is happening in the human mind and the human body. First of all, as we have already spoke about fear, we have spoke about worries, we have spoke about anxious, we have spoke about depression. When now this person is going through knowingly that they have been told that they have got contracted COVID-19 or COVID virus, what comes into their mind is that this is a virus. Of course, they got information that majority of the viruses, there is no treatment, especially with the Lennon people. Now, the only thing they focus into is death, with losing hope. And while that is happening, it is that there is what we call, I wouldn't want to use the medical term, there are chemicals in our brain that regulates how our emotion, how we think, and how we feel. So because of all those feelings that we are getting, those chemicals may then start to be produced more, or they will be produced lesser. As a result, they have got a negative impact in one's brain. At the end of the day, for instance, there is a chemical called serotonin. If then the brain starts producing more because it's the demand of the worries and the anxious and the fear of that person have, then this person now starts to develop depression. Then when this person develops depression, this person will not have enough sleep. This person will not want to eat. This person will have all those worries. And when they are not eating, then they do not have enough nutrients to feed their body that need to fight the viruses in their body. So as a result, the combination of that will now cause deterioration on the response of this person's to get healed. So as a result, they may then react differently. They become agitated, they become restless, they become irritable, then the body itself gives in. So as a result, the virus will now win the war. So we need to have a sound mind, and we need to at least to listen, like what Esther was saying. We need to have hope that, okay, I'm having the virus, but then I'm in the hospital. In the hospital, I'm going to receive medication, even if it's not to kill the virus, because it comes with some inflammation, it comes with some complications, even the bacteria can set in. So whatever is given, whether it's the antibiotics, whether the anti-inflammation, whether the antidepressants, this person needs to take it with hope to say, I will recover. But then if the person gives in, of course, this person will not recover from COVID, then can develop complication. So, and the emotion of that person, that's why we are worried about even the doctors who are taking care of this patient. If they are mentally well-being is not being taken care of, they will not be able to encourage. And even just by attending to the patient, their work is not just to prescribe the medication, but just to give an hearing ear to them, to listen to what this person is saying. Or because also it comes with pain. These people suffer from pain, especially those who goes into complication. And the medication, we know it can work, but this person, they need somebody to speak to. I remember one of the person who, the survivor, was saying it is terrible because, in fact, even the doctor who's coming to see you, you don't even see the face of that person. The person is full covered. Then you wonder who the person is attending to you. With all those, I know it is very important for them to cover themselves because it's for protection purposes. But while you are protecting yourself, at least if the patient has got anything that they want to ask, listen to them. And especially if they are indicating that they are very emotional, they are very stressed, maybe they are even depressed, and you pick up a depression as a doctor, then you must then communicate to other professionals so that we attend to this patient as per a biopsychosocial support model, whereby even if it's required that this person is in ICU or in a respiratory unit and they need a psychologist to go there and speak to this person, this psychologist can as well go there wearing the PPE and deliver to this person who really need that assistance from that person. Because mostly it's these things that kills the people, the fear, the anxiety, the depression, of course, the disease itself. But if we do our treatment, biopsychosocial support, I'm sure our patient will come out victorious from this virus. They really indicated to themselves that they need somebody. But then you see, even nowadays, you are being reported that there are deaths that are happening at home. What I found out from some of these relatives, they are expressing that they are even afraid to go to the hospital. Then I ask, what is that you are afraid to go to the hospital? They are saying they are afraid to go to the hospital because they are going to get corona from the hospital. But what the information that now we want to give to the community is that corona is now community acquired. What does that mean? It is within the community. It is no longer just in the hospital, but it's within the community where we live. So what we need to do is, when you find out that you are not feeling well and you are having some symptoms, whether they are not suggestive of corona, you are advised to go and seek medical help. Go to the hospital, go to the clinic which is near you. I know somebody who went to the clinic which is nearer, and this person was transferred to the hospital. But then, because now the staff have to protect themselves because they do not know who has corona and who do not have corona. Immediately when this family member was received by the staff of the hospital wearing the protective clothing, they already communicating to other family member to say, apparently it sounds like the patient has got corona. Then the question was, how did you know that the patient has corona when the patient was not even tested? Because the people who attended to the patient were wearing those white overall. So as we are saying, we as staff members of hospital, we are trying to protect ourselves. But I think also the protection that we are using, it is also sending a different message to the society. So I would want to take this opportunity, at least now, to inform the nation, not to be afraid to go to the hospital. And whenever they see the hospital staff in those overall or wearing those PPE, personal protective equipment, is for them to protect themselves, because if they do not protect themselves, then they can also then become sick, and there will be no one to take care of the others who are ill.
Absolutely.
So the people should not be afraid to go to the hospital.
Yes, absolutely, doctor. And both of you working with the mental health care unit at the hospital, I know that Central also has its COVID ward. And in that experience, do patients at the hospital get psychological or psychiatric treatment when they're in there for COVID, or is it something that they have to request? Doctor?
Maybe before Esther responds to that, I think those who receive the psychological treatment is those who have been identified to express their emotion, to express how they feel about it. And those who do not, and depending on the illness, if somebody is maybe some semi-unconscious and is in ICU or in a respiratory unit, then this person is hopeless and they cannot even express their emotion, that they can be identified to say they need someone to come over to take care of them. And apart from that, it is also the staff. We do not have enough staff members to be able to do that. I know the social workers are there on the ground, but even when they are there, they are not enough to make sure that they able to attend to each and every person being in the hospital admitted, so that they will be able to do their psychosocial therapy. That is also one of the problems that perhaps need to be looked into. But those who perhaps they have lost their loved one, we are appealing that instead they should seek help. They should come to the hospital and express how they feel about it. Then we also have many of the families who either they lost their loved one or they have suffered from COVID and they really needed some support. We do attend to them, and it's almost, if not on everyday basis, you see someone coming to you to say, I'm angry with this disease. At least I thank God that I did not die. And I don't wish it to happen to anyone, of course, but the emotions and the pain that they are explaining, it is felt by us, the health professionals, but also the complication that the community should also understand that it takes some time before the healing process complete. I have seen, I think, almost like 5 patients who they develop pain, lung, and depression, and I have been seeing them, I have put them on antidepressant. But I always ask them to go back to their physician so that they make sure that everything is fine. So we need to work together as a team so that they are being evaluated for how far they are healing, and also their psychiatric problems, and they can feel that people are there to sympathize and also to get a proper treatment for them.
Absolutely. Thank you so much for that, Dr. Ndjaba. And as we near the end of our show, I just want Esther, if you could please just give the nation just some advice in terms of what to do to maintain their mental health as we live through this pandemic. Because, of course, right now it's open-ended. We don't know how long this is going to be our new normal. So what should people look out for, and how do they best take care of their mental health?
Okay. To take care of your mental health, you need to take care of yourself. So self-care is very important. And it's not anything complicated. Just like I said previously, stay positive, go out and exercise, eat well, drink a lot of water. And one thing that's also very important, limit the amount of media consumption that you, or filter it. So only listen to sites or go onto or listen to reputable news sources to minimize the level of anxiety, because if you keep hearing a lot of news, especially negative news, it just increases your anxiety levels. What also helps is maybe having meditation, like I said, contact with people, not necessarily physical or in a social setting, but calling your loved ones. We have Zoom now, Skype, and other means of communicating with our loved ones, trying to keep in touch with them, and supporting them and allowing them to support you as well. Yeah, that's basically what we need to do now. Yeah, to try to keep in contact as much as possible, but also in a safe way.
Yes, absolutely. Thank you for that, Esther. And Dr. Ndjaba, thank you so much as well for your contributions to this discussion. I think as final takeaways, what we're realizing is that the mind and the body are very in sync. And as you take care of your body, you also have to take care of your mental health, of your mind, especially for people who are experiencing the trauma that comes with having contracted the virus, people that are dealing with the trauma of having lost loved ones. Your mental health is just as important as your physical health. That's all we have for you this evening. Thank you so much for joining us. To our mental health professionals, Esther, Dr. Ndjaba, thank you very much for joining us and sharing those very important insights. And I hope that this is a message that, someone who isn't watching can in some capacity latch onto, so that people make sure to prioritize their mental health as well. And from the studio tonight, I'm Arlana Shikongo. Thank you for joining us, and good night.